Hi guys, welcome to Medicine Jerk. This is Dr. Taj. Today we are going to discuss about one of the most important topic, that is ACLS guidelines. ACLS guidelines means Advanced Cardiac Life Support Guidelines. Okay, I'll explain these guidelines in the form of an example, right? So, for example, there's one patient called as Rahul, one individual called as Rahul who is ready to board the flight within the airport, and you were the doctor in that airport, right? Okay, before you only, that patient has suddenly collapsed. Okay, and so you should follow these ACLS guidelines in the form of an mnemonic. Okay, you were the doctor over there. After seeing the patient collapse, you should follow this mnemonic. Okay, and the mnemonic is safety, help, response, safety, help, response, pulse, and respiration. Right? Respiration. Okay, we'll elaborate this mnemonic. Okay, safety, help, response, pulse, and respiration. Okay. Okay. First one. What is safety? Okay. Number one, safety means we should check the scene safety. And second one is help. That means we should call for the help. Okay, you should call somebody for the help. Okay, and third one is we should check the response of the patient. Okay, not of the surroundings. It's about the response of the patient. And the fourth one is the pulse. For the pulse, fourth one is the pulse, right? Okay, for the pulse, we usually check the carotid pulse. Which is usually done in adult people. Okay, and we can also check brachial or the femoral pulse. Okay, we can check the brachial or the femoral pulse, which is usually done in children's, as carotid pulse palpation is difficult in the children. Okay, and last one is the fifth one, that is the respiration. You should assess the respiration. You should check that patient is breathing or not. Okay, we should assess the respiration. Okay, and here the fourth and fifth steps should be checked simultaneously. Okay, we should check it simultaneously. Okay, after checking above all the guidelines of ACLS, if everything is negative, that means fifth step is the respiration. If the respiration is negative, okay, that means we should start CPR. What is CPR? CPR means cardiopulmonary resuscitation, which is usually done in cardiopulmonary arrest. Okay, in CPR, first of all, we should start the chest compressions. Okay, and these chest compressions should be started in a ratio of 30:2. Here the 30 indicates the number of chest compressions. Okay, while the 2 indicates the number of breaths. Usually in the healthcare settings, we should give the breaths with the help of ambubag. Okay, and these 30:2 chest compression should be done for 2 minutes. That means 30:2 for about 5 cycles. Okay, 5 cycles of 30:2 should be done. That means 100 to 150. 100 to 150. Just wait. I think this is not necessary for you people. I'm just wiping it out. Okay. Okay. After completing the 5 cycles, you should get the ECG done. If the ECG indicates a flat line, that means asystole. Okay. If the ECG indicates a flat line, asystole, that means you should continue the CPR for 2 minutes. Again, injection epinephrine should be given. Okay, which is usually of 1:1000 dilutions, and yeah, of course it is given in the IM form. But if you are getting the ventricular fibrillation over the ECG, you should give the shock to the patient. That means you should give the DC shock. DC means direct current shock, and this DC shock can be given in the form of two types, that is monophasic DC shock or the biphasic DC shock. Okay, monophasic DC shock and the biphasic DC shock, and the dose of monophasic DC shock is 360 joules. It is 360 joules. Here it can be given from 120 to 200 joules. Okay, we'll see some of the important points of the chest compressions. Okay, some of the important points of the chest compressions. So one is the location. The location of the chest compressions is important. Okay, usually in the adults, the chest compressions should be started over lower 1/3 of the sternum. Lower 1/3 of the sternum. Okay, lower 1/3 of the sternum. If it is pregnant female, if it is a pregnant lady, then if it is a pregnant lady or the pregnant female, you should start the chest compressions over above the intermammary line, above the intermammary line with 30 degrees, above the intermammary line with 30 degrees tilt to the left side, okay. If it is children or the infants or in the pediatric age group, you should start the chest compressions below the nipple line. You should start the chest compressions below the nipple line. Okay, these are the locations of chest compressions. Okay, one more important thing, that is compression rate. We should also aware about this thing, because a lot of MCQs are asking in this compression rate. Okay. Okay, we'll check the compression rate in just like adults. Yeah, we'll check the chest compression rate. Okay, in adults. In adults, in children's, and in neonates. Okay, I'll add the chest compressions one more column. Okay, and one more column will be rescuers. Rescuers should be remembered in the form of a simple mnemonic. Okay, 1122. Okay, in adult it must be 30:2 chest compressions. In children 30:2 or 15:2 can be done, while in the neonates 3:1. Okay, rescuers will be just remember in the form of a mnemonic. Okay, that is 1-1-2-2. This is enough. 2-2. Okay, and one more important thing, and the most common organ to be damaged during the CPR. Most common organ to be damaged during the CPR is your liver. And the most common ribs to be fractured during the CPR. Most common ribs to be fractured during the CPR is your 4th to 6th ribs. 4th to 6th ribs. 4th to 6th ribs. So guys, I hope these are some of the important points of ACLS guidelines, and these points will be helpful for your examination. Okay, signing off. This is Medicine Jerk.